Glycemic management in a patient with type 2 diabetes. Diabetes type 2 is a metabolic disorder that is characterized by hyperglycemia in context of insulin resistance and relative lack of insulin. Type 2 diabetes makes up of 90 of cases of diabetes, with the other 10 die primarily due to diabetes mellitus type 1 and gestational diabetes.
Understanding type 2 diabetes. Type 2 diabetes is a metabolic disorder that causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream. The most notable symptom of diabetes is frequent urination and excessive thirst. Other symptoms include weakness, drowsiness, and blurred vision. These are caused by chemical imbalances in the blood related to high levels of blood glucose. About 1 in 4 people with type 2 diabetes are unaware that they have the disease. It is important to catch diabetes early. Over time, high blood glucose damages the blood vessels, which can damage the organs that these vessels supply, leading to a variety of health complications. Damage to the small or micro blood vessels can cause vision problems, including loss of sight, nerve damage, and kidney disease. Damage to larger or macro blood vessels can lead to cardiovascular complications such as heart disease, stroke, and poor blood circulation. Overweight and inactivity are major causes of diabetes. A family history of diabetes significantly increases your risk of developing the disease. Certain ethnic populations are also at increased risk of developing type 2 diabetes. Finally, some medications may increase your diabetes risk, specifically corticosteroids, thiazide diuretics, drugs used to treat certain mental illnesses, and some antiretrovirals used to treat HIV infection. In summary, type 2 diabetes is a metabolic disorder. It causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel for the cells in our body. If not,
Long-term complications from high blood sugar can include heart disease, stroke, diabetic retinopathy, where aging is affecting kidney failure, which may require dialysis, and poor blood flow in the lungs, leading to amputation. Cause: development of type 2 diabetes is caused by a combination of lifestyle and genetic factors, while some of these factors are under personal control, such as diet and obesity. Other factors are now shown as increasing age, family, gender, and genetics. A lack of sleep has been linked to type 2 diabetes. The nutritional status of mother during fetal development may also play a role, with unproposed mechanisms being that of altering DNA methylation.
Reverse it. Visit visit us at thebloodsugarblueprint.com. Hey folks, it's Dan Solomon with thebloodsugarblueprint.com coming at you with another session of our diabetes information series. Today we're going to talk about risk factors for type 2 diabetes. No one knows exactly what is the cause of diabetes, but what we do know some things called risk factors, which actually increase your chance of having type 2 diabetes. So the risk factors for type 2 diabetes include being over the age of 45, being overweight with a BMI greater than 25. There's various websites on the internet that you can go to get this calculated for you, but basically it takes into consideration your height and your weight for that height. And having a family history of diabetes. If your mom, dad, grandparents had diabetes, you have basically double the risk of developing it yourself. Being African American or Hispanic, you're likely to develop it too. Being sedentary, not working out on a regular basis, being active. And for women, if you've had diabetes during your pregnancy or gave birth to a baby that weighed greater than 9 pounds, you have an increased risk of developing it after the pregnancy or years down the road. Some women actually, if they develop diabetes during the pregnancy, that actually stays with them post-pregnancy for some women. Having a high blood pressure, which is considered 140/90 or higher, increases your chance. Having an HDL, good cholesterol level, lower than 35 milligrams per deciliter. And of course, you would have to go to your doctor to get that tested. And having triglycerides, which are basically blood fat, level of 250 milligrams per deciliter or more. And again, you would have to go to your family physician to get that tested. Now, for more great information,
The overall aim of glycemic management is to minimize long-term complications while avoiding severe hypoglycemia events. Where is most effective oral monotherapy for glycemic control in a patient with type 2 diabetes? Metformin or glucophage has shown additional benefit when compared with other treatments, including insulin, for diabetes-related outcomes and all-cause mortality, and should be considered the agent of choice for initial monotherapy, particularly in obese patients.
Watch diabetes videos at clearlyhealth.com. Metformin medication reduces the amount of glucose released by your liver. When you have type 2 diabetes, your body is less responsive to insulin. Your cells cannot absorb enough glucose, causing it to build up in your bloodstream. A high blood glucose level over a long period of time can lead to serious health complications. Your body's primary source of glucose comes from the food you eat. Your liver also releases glucose. Metformin targets the liver, signaling it to slow the release of glucose. It also helps cells use the glucose available in the blood. This two-step action helps to reduce your blood glucose level. For our full library of healthcare videos, go to clearlyhealth.com.
Conclusion: glycemic control is no ultimate goal of diabetes treatment. The focus should be on which medication best reduce morbidity and mortality. Thank you.